Good morning, everyone. I hope you all having a pleasant morning. And I'm excited to have the chance to talk about my PhD work, which we have been diligently working on, the role of various physiotherapy modalities in the treatment of pelvic pain syndrome. My name is Gökçe. I'm a full-time PhD student at Semmelweis University. I believe pelvic pain will be alleviated with the knowledge of advanced physiotherapy methods. My mission is to enhance the quality of physiotherapy treatments for patients, resulting in better patient outcomes and overall well-being. Currently, we have 2 ongoing projects, and you will hear more about them in detail in the following minutes. The title of our first project is Investigating the Effectiveness of Physiotherapy Methods in Women with Endometriosis-associated Pelvic Pain. Endometriosis affects more than 190 million women. Among these women, infertility and/or pelvic pain ratio is as high as 35 to 50%. And physiotherapy techniques might be efficient in the treatment of endometriosis by reducing inflammation, relieving pain, and improving quality of life. There are various physiotherapy techniques which can help to ease patient pain, such as exercise, manual therapy, or physiotherapy modalities like electrotherapy or laser therapy. Our aim with this project is to investigate the effect of physiotherapy methods in relieving endometriosis-associated pain. Accordingly, we ask, are physiotherapeutic interventions effective in decreasing pelvic pain in patients with endometriosis? We choose our population as women with endometriosis-associated pelvic pain with the intervention of various physiotherapy techniques compared to non-physiotherapy techniques, and our outcome is pelvic pain change. Our hypothesis is like physiotherapy techniques have the same or superior effectiveness compared to non-physiotherapy techniques in the treatment of pelvic pain. We conduct our systematic search in 3 major databases. We use 2 domains, and after a carefully conducted selection process, we ended up with 8 eligible full texts. In figure 1, you see the pain score from various studies comparing the control and intervention groups at baseline, follow-up, and the change. In the baseline panel, you can see in each study, both groups were started with the similar pain levels. However, in the follow-up, there are some differences. And the change panel shows us that while the control groups were able to make some change from 0 to 3 units, the intervention group was able to do this change from 2 to 6 points of change. And in this first plot, we investigated women with endometriosis-associated pelvic pain. We included studies with the intervention of physiotherapy techniques as exercise, physiotherapy modalities, and manual therapy compared to non-physiotherapy techniques such as placebo or control groups. And our sample size is small. Our heterogeneity is moderate to high with 6 to 7%. And the differences between pain scores between the control and intervention groups can be seen in the MD column. And the pool effect shows us the change in pain score was about 2 units better in the intervention groups with a p-value smaller than 0.05. In summary, this plot shows us physiotherapy interventions are able to reduce pain 2 units better compared to control groups, and they show us clinically relevant and mathematically significant results. After seeing the overall efficacy of physiotherapy, we wonder which method will be more efficient among the included studies. And it turns out all of them effective. However, physiotherapy modalities are the best one among them with the change of more than 2 units and the p-value smaller than 0.05 again. And regarding the application sites, among 7 studies, 5 used locally applied and 2 used generally applied interventions. And locally applied techniques were more efficient in reducing pelvic pain regarding the endometriosis disease. Although our research has produced notable findings, it's important to acknowledge that there are some limitations as well as small sample size, including studies with subjective assessment methods and also uncontrolled comorbidities related to medicine intake. However, this study also comes forward by filling the gap in the literature regarding endometriosis-related pain. And to the best of our knowledge, this is the only study which used physiotherapy techniques exclusively. And it's also the first study to highlight the impact of localization of the applied techniques. In conclusion, physiotherapy techniques effectively decreases pain. especially when locally applied techniques are used, and the physiotherapy modalities are the most effective one among the included studies. We highly suggest clinicians who treat endometriosis patients to include physiotherapy techniques into the therapeutic options, and more research is needed in larger sample sizes with or without additional drugs. And we completed our manuscript. We are planning to submit it to the internal review just today, and our aim is to publish it in BJOG. Please allow me to talk about my second project, investigating the effectiveness of physiotherapy methods in women with menstruation pain. Menstrual pain, dysmenorrhea, affects 50 to 90% of women worldwide, and this pain heavily impacts women's quality of life, productivity, and focusing ability. Currently, usual care mostly focused on pharmacotherapy with the prescription of NSAIDs. However, these medicines have some side effects from headache to cardiovascular diseases, and they come with some contraindications such as kidney diseases or stomach ulcers, and they can cost up to $125 per month. Accordingly, there's a need to explore innovative and effective treatment techniques. And physiotherapy modalities are excellent therapeutic additions and or alternatives to the standard care. As they are non-invasive, they are cost-effective, have low risk of side effects, and they help reduce pain intensity and the duration. And our aim is to assess the most effective physiotherapeutic treatments in reducing menstrual pain. Our question, do different physiotherapeutic approaches have diverse efficacy in relieving menstruation pain? Our population, women with menstrual pain, with the intervention of various physiotherapy techniques compared to physiotherapy techniques, our outcome is pelvic pain change, and we would like to include only randomized controlled trials as a study design. We hypothesize that various physiotherapy techniques might have different efficacy levels in decreasing the menstruation pain. Our research implication is to apply the most effective physiotherapeutic approach in reducing menstruation pain. We conduct our preliminary research in 3 major databases. We use 3 domains for that, and we are planning to submit our Prospero registration by 15th of September. In summary, currently we have 2 ongoing projects. Both of them are systematic review and meta-analysis. We are planning to submit our first project on next September, and our second project on March 2025. Before ending my presentation, I would like to leave you with an inspiring quote from Fatih Sultan Mehmet. To see the limits of the possible, one must attempt the impossible. Thank you for your time and your kind attention.
Congratulations to your nice presentation. I would like to ask regarding to your first project that do you use these physiotherapy techniques in your clinical practice, or are you planning to use it?
Thank you for your question. Well, currently I'm not doing any practice. However, in the past I was using these techniques.
Congratulations for your great presentation. I would like to ask which physiotherapy technique was the most successful related to the first question?
Thank you for your question. Well, as long as I mentioned that the effective group was physiotherapy modalities, the laser therapy was the most successful one, and definitely there is more research needed in this topic.
Thank you very much.
I also would like to have a question for both of the projects. The first one is that when you are talking about endometriosis-associated pain, how did you define it? I mean, you took all the things into one group, like the dysmenorrhea or the chronic pelvic pain, or you were just taking the chronic pelvic pain, or what was your method for this?
Yes, we searched for the chronic pelvic pain because it was like one of the symptoms of the disease, and it's mostly related to our file, so.
Okay, thanks. And my second question is that you were saying that the weakness of your project is that there were more studies with subjective assessment of the pain, and how can you make the assessment of the pain objective? I'm really curious about that.
Well, thank you.
What do you mean by that?
Thank you for the question. This is one of our limitations. However, I'm not looking from the, we focused to solve this issue a lot, and we couldn't come up with another solution. However, this helps us to see the real-life impacts of the patients, because now we know how disease affects the patients in real life. And as clinicians or as a physiotherapist like me, it's more important to see the patient's reaction. So I think it's also important to tell that our study helped to see real-life experiences as well.
Congratulations, Gökçe, on your progress. I have a simple question regarding to your first project. So you are comparing physiotherapy patients with no physiotherapy. Mm-hmm. Both group received pharmacotherapy as well, or?
Only in one study, they also received hormonal therapy, but it was in the both groups. So it's don't have any additional effects compared to studies.
Okay, so all the population in these studies were receiving only physiotherapy without pharmacotherapy?
Without hormonal therapy, except one study. But as I mentioned, there are some missing information about the medicine intake. So we don't know if they continue to receive medicine intake or not. And this is also like important thing to highlight, that we need more research about that title or topic as well.
Yes, yeah, thank you.
Thank you.